We are going to give you a brief overview of why all chiropractors need to document their techniques and why in the last 100 years of our profession, not documenting what we do has resulted in many ills. If someone were to ask you the following question:
do you document the techniques used in your office? Yes, you. I'm sorry. I can talk to you, but you can't talk to me. Maybe we could enlist the help of Dr. Lee Abbott to speak for you. Lee?
Hi, John.
It's good to see you. Could I ask you to speak for the chiropractors watching the CD?
Yes, I will.
Very good. Thank you. Have a seat. So, Lee, do you document the techniques used in your office?
Yes, I do. I write down the listing.
I'm not talking about the listing. I'm talking about the actual technique itself. Was the patient sitting or standing? What was your actual contact?
If I use the Gonstead technique, I write down Gonstead.
Well, I'm sure you do use Gonstead, but I'm equally sure you use other techniques as well. And what about those techniques that you've developed from scratch, personal techniques? They're not listed in any books.
Well, I don't write down those techniques. I can't.
Well, thank you for being honest, Lee. Many doctors wouldn't acknowledge this. But the fact is, you don't document your techniques. And over 90% of the profession has the same problem. A single vertebral listing has many techniques that can be applied. And I'm sure you've used different techniques for the same listing, haven't you?
Yes, I have. If a person comes in and I find that he or she has a posteriority of C5, there's about 5 different ways I can move that vertebrae.
Well, how do you determine which technique you use?
Effectiveness of the adjustment and patient comfort.
That's excellent, Lee. So we can say that chiropractors have many options when it comes to techniques used on a single listing. But don't you think it's important for the patient that the doctor write down the exact technique used? In fact, don't you feel that documentation of technique is the most relevant clinical data that can be recorded?
I feel it's very important, but a lot of the times the doctor just doesn't have the time.
Well, the time problem has been solved with the Dewberry system. In fact, documenting your technique now can actually save you time by eliminating the guesswork. And that's what we're going to talk about in this CD, as you'll see later. But let's summarize the problem. If a patient comes back to you after 6 months or so and wants to be treated with the same technique, how do you know what technique was performed?
Usually I don't have that problem.
Really? All right, let's say the patient says, "Doc, for 6 months I was in pain. You finally fixed me. It was wonderful. But I have to be honest, several of the adjustments that you gave me weren't working, and I was about to give up. But that last treatment you gave me was fantastic. Could you do that again?" Does that sound familiar?
Yes, it does. Usually I'll look in the chart, and if there's no reference made to the technique, I'll ask the patient, were you sitting, were you standing, were you lying down? And I'll try to reestablish the technique that I used.
So what you're telling me is that you were basically wasting time trying to determine the technique used.
Yes.
All right, well, let's say that same patient comes back to you and sues you after 6 months or a year. And what are you going to do when the jury asks you to demonstrate the exact technique used? In fact, what are you going to do and how professional will you look when the prosecuting attorney determines that there is actually no record of documentation whatsoever?
Yes, but I do dictate a several-page report on many of my seriously injured patients, which is very indicative of the treatment rendered.
Yes, but the report that a chiropractor gives is first a medical report, not to help another colleague, but to simply satisfy the needs of an adjuster or a lawyer. A typical chiropractic report simply states chiropractic techniques were performed, period. That's it. Nothing is said about the exact technique used. I mean, it could be clapping your hands or singing a healing song. No one is going to question it, not even the IME doctor. Lee, it's as if chiropractors are ashamed to describe what they do. For a profession that brags about educating its patients, it needs to start educating the people that pay the bills, lawyers, adjusters, as well as patients.
I concede. I don't do that much to document my techniques. But this is for technical reasons. I feel that the standards of the chiropractic profession as far as documentation of techniques has increased considerably over the last 20 years.
But what standards, Lee? The standards of some doctor that developed an orthopedic test almost 100 years ago? We're using antiquated orthopedic tests that have low clinical significance because they were developed by people almost a century ago that have no clue about modern medicine. We prefer to document the positioning of orthopedic tests rather than the positioning of chiropractic techniques. Simply put, we prefer bad medicine over good chiropractic documentation.
You're right. The necessity of establishing an interprofessional relationship has forced us to use orthopedic testing, even though there is much more important clinical data that should be used before these orthopedic tests. The medical profession has similar problems. They oftentimes can't document any better.
Are you sure, Lee? Because heaven forbid that your patient would end up with disc surgery, and you would have to go to court to defend the appropriateness of your treatment. The surgeon would detail to the court with great precision the exact port of entry for the surgery, the landmark used, and even the size of the catgut. And how would you feel with a few chicken scratches at the bottom of your report to describe your chiropractic technique? Or worse yet, the complete absence of such a description. But be reassured that you would be no different than 90% of your colleagues today in the same situation. But all of this can radically change as chiropractors begin to use the Dewberry system.
With the Dewberry system, for the first time, any profession performing adjustments or vertebral manipulation can document exactly what is done on each patient. This renders our job exciting again, giving us back the taste for improving our hands-on approach. This makes our documentation stand out and is unique to our profession. Documenting the technique that you perform is not a question of choice. It's a question of time. With the publication of this CD-ROM, in 2 years from now, not documenting your technique will be the equivalent of substandard care, with all the legal implications associated with it. You can make a smart choice now and put new fire in your professional life. Speak, write, and show what you do and be proud of it. Help your patients more, communicate with your colleagues, and protect your liability. Document your techniques with the Dewberry system.